What actually makes a sample urgent? Explained by your favorite lab rat, Sherry. Hi, welcome to my channel. I'm a certified medical laboratory scientist, and today, let me tell you how to properly communicate with us to get your sample as fast as you can. So first, make sure you order them stat. Yes, when we see that label, we absolutely will process it as soon as we can. But other than that, is there anything else you can do to make us run it as soon as possible? Yes, absolutely. So first, let's start with some unstable specimens. Things like coagulations, even you don't order them stat, we will still trying to get that process fast because most of the tests on it are not stable. They expires within hour to 4 hours. So even you forgot to order them stat, most likely will still run as fast as possible. But I know sometimes you feel like it's when you send out the factor assays, it seems takes so long. And let me tell you, because to prepare those kind of tests on the analyzer takes a whole lot of the time. We need to start with the reagent prep. And if you want that really fast, if you are in middle of a surgery or your patient is really bleeding out or you are predicting your patient will be bleeding out very soon, then one of the things you can do is give us a call and tell us exactly which factor assay are you looking for. And make sure you tell the tech who pick up the phone to get the reagent all prep while you call and tell them you are about to draw the patient. You need it as soon as possible. You will be sending down stat. Give them the patient name and the medical record number. Tell them you can start the reagent prep right now. Most of the time, the person pick up your phone call will do so. And make sure when you call the lab, you are calling the coag bench. Yes, not the hematology. Hematology people are the ones who running your CBCs and CBC differentials, called the coagulation bench. Sometimes they are being setting up as special coagulation. You can try either one of them as long as it's a coag. So what about the timed sample? You know, the ones you order by the sequential, like every 2 hours, 3 hours, or every morning at 6 o'clock, 8 o'clock. Those kind of tests are not stat. They are not. Okay. They are timed for you and they are for our phlebotomist to remember a time to go to draw your patient, but it does not guarantee you a turnaround time. So if you need a result by a certain point and it was labeled as routine, give a call. Not to the customer service, not to the central receiving. You would unfortunately have to call each bench separately. So make sure you order those kind of things stat, unless you want to make bajillions of phone calls to every single bench of the laboratory. And what about the type that your patients are literally in critical? Yeah, that's another unfortunate thing I have to tell you. We, in the lab, we don't get to see anything like the patient vitals, all the other details, falls, coding, none of that. You can call if you forgot to order them as a stat, but we do not see them. We actually don't even know there is a sample coming unless they already show up at the bench. And if you were in a hurry and order them as routine and just send it down, it doesn't matter how critical your patient is, we are not going to run them as critical. So that brings a question of how to make a routine test become stat. There are two scenarios. If you are in a small hospital, where I'm talking your hospital maybe have less than 100 beds, most likely your hospital does not have a automated line to sort your samples. In that case, congratulations. Give the lab a call. They can absolutely pick up your patient samples and manually squeeze them in front of the line and run it as a stat, even without a stat order. But if your hospital is large, for example, a teaching hospital of a university or level 1 trauma center or those kind of like having 500 to 1000 bed or more, very likely your hospital would have a automated line that would sort the sample beyond the human touch. And if you forgot to order them as a stat, nobody can do anything about it. Those automated lines are very dumb robots, and we cannot give them an order, tell them, hey, this sample is actually stat. The only window you can catch that is as soon as you send it, I immediately rush over to the phone, call the lab within 5 minutes. Your window to call is really, really short. And for those kind of calls, make sure you call the central receiving, not the analytical bench, the central receiving. So when they get the sample at the central receiving with the patient name and medical record number, they will reorder everything and change the status from routine to stat. Okay, let's talk about the ER samples. If you work in the ER, you might think every sample sent out from your hand are automatically urgent stat, but actually it is not. The ER samples is just a location labeling. We treat them exactly the same as how we receive from the floors or any offsite outpatient. So you're still gonna need to manually order it as stat. The only difference is between nighttime and daytime. During the nighttime, we pretty much treat everything as a stat. So even you forgot to order them as a stat, you send a routine. Don't worry about it. The only time you will have a significant difference between stat versus routine sample during nighttime is when you have 200 people sitting in the waiting area in the ED, which is pretty rare. So, by conclusion, you should absolutely place it as a stat order if you need it fast. But if you forget, you can call the lab, not the customer service, but the actual lab area. Within 5 minutes out of your hand, call the receiving bench. After that period, call each analytical bench. And let's give you a quick reference which analytical bench to call. Type and screen, blood transfusion, anything related to that, call the blood bank. Any bacteria or virus related, call the MyCore. Anything CBC or CBC with differential, call the hematology. All the coax, factors, PT, PTT, D-dimer, those kind of stuff, light blue top, called coag. Any green top and red top having electrolytes, enzyme, hormones, those kind of stuff, your troponin, call the chemistry bench. And all the other ones, if they are that special, you don't have to call anybody because they will be batched and wrong, and they are automatically routine. Hope this explanation helped your work. This is Lab Rat Sherry. Leave me a comment if you want me to explain more things from the lab end. See you next week.